the Spanish flu, the forgotten pandemic. In 1918, much of the world was trapped inside the most destructive war modern history had yet seen. Then an invisible enemy appeared. It moved through military camps, railway stations, troop ships, cities and villages. During the pandemic, an estimated 500 million people became infected, roughly 1/3 of the world's population at the time. Tens of millions of people died. Yet history would almost forget it. This was the Spanish flu. The 1918 influenza pandemic spread across almost every inhabited region of the world. Its timing and severity varied, but in many cities, hospitals became overcrowded, public gatherings were restricted, and ordinary life changed almost overnight. Unlike most seasonal influenza outbreaks, the pandemic killed large numbers of healthy young adults. Evidence suggests that secondary bacterial pneumonia caused or contributed to most deaths. There was no influenza vaccine. There were no antiviral medicines. Effective antibiotics were not yet clinically available to treat bacterial complications. To understand why the virus spread so quickly, we must return to a world already at war. Millions of soldiers were concentrated in trenches, barracks, camps, hospitals, ports, and railway stations. American troops crossed the Atlantic aboard crowded ships. Soldiers, laborers, refugees, and civilians moved across continents. These wartime transportation networks created ideal conditions for infection to spread. But the pandemic's exact origin remains uncertain. Major theories have pointed to the United States, northern France, and China, but none has been conclusively proved. A major early outbreak was documented at Camp Funston, part of Fort Riley in Kansas. Other researchers have proposed earlier circulation near military camps in France or through wartime labor networks connected to China. Spain was not the confirmed origin. The country became associated with the disease because it was neutral during the war, and its newspapers reported the outbreak more openly than the press in several combatant nations. Reports that King Alfonso XIII had fallen ill reinforced the misleading name. The first widely recognized wave appeared in spring 1918. It was highly contagious but generally less lethal than the wave that followed. By summer, it appeared to be receding in many regions. Then the pandemic entered a far deadlier phase. During autumn 1918, patients could deteriorate with terrifying speed. Some patients developed severe pneumonia. Others developed cyanosis, turning bluish or dark because their blood was not receiving enough oxygen. The unusually high mortality among young adults may have involved the characteristics of the virus, age-related immune responses, earlier influenza exposure, and vulnerability to bacterial pneumonia. The exact explanation remains debated. The virus spread mainly through infectious respiratory particles, especially in crowded and poorly ventilated spaces. Troop ships, railways, military camps, ports, cities, and public gatherings carried infection across the world. Some indigenous island and remote communities suffered catastrophic losses. The causes varied, but limited medical access, social disruption, crowded housing, and vulnerability to introduced infection all played a role. In heavily affected cities, schools, theaters, churches, and businesses closed. Temporary hospitals appeared in armories, schools, and community buildings. Medical workers became exhausted and often fell ill themselves. Some cities faced shortages of coffins, hearses, undertakers, and gravediggers. Authorities relied on isolation, quarantine, gathering restrictions, hygiene campaigns, ventilation, and in some places, mask rules. Philadelphia became one of the best-known examples of delayed action. On September 28, 1918, officials allowed the city's Fourth Liberty Loan Parade to proceed despite evidence that influenza was already spreading. Around 200,000 people crowded the streets. The parade did not create the epidemic, but it became a major amplification event. Hospitals were soon overwhelmed and deaths rose sharply. St. Louis acted earlier and experienced a lower mortality peak during the principal autumn wave, although the city still suffered significant illness and death. Calculating the final global death toll remains difficult. Records were incomplete, and many victims died from pneumonia or other complications without influenza being recorded as the primary cause. Worldwide deaths are estimated in the tens of millions. Approximately 50 million remains the most frequently cited figure, although published estimates vary substantially. British India suffered one of the greatest documented losses, with commonly cited estimates ranging from about 10 million to 20 million deaths. The United States lost approximately 675,000 people. Based on the frequently cited estimate of around 50 million deaths, the pandemic likely killed more people than the First World War, although the comparison depends on which wartime deaths are included. Yet the pandemic soon faded from public commemoration. Its deadliest phase arrived during the final months of the war. When the armistice was declared in November 1918, public attention shifted toward victory, returning soldiers, political upheaval, and rebuilding. The pandemic had no battlefield, no surrender, and no clear moment of victory. It produced far fewer monuments and national ceremonies than the war. Its victims were remembered mainly inside families and local communities. The pandemic nevertheless changed public health. It contributed to greater interest in disease surveillance, mortality reporting, epidemiology, and public health administration. Human influenza, a virus, was first isolated in 1933. Decades later, researchers recovered genetic material from preserved tissue and reconstructed the complete 1918 virus under high-security laboratory conditions. The Spanish flu revealed how quickly disease could exploit the systems connecting the modern world. It showed that war, transportation, crowding, inequality, and delayed action could turn an outbreak into a global catastrophe. And it showed that even one of history's deadliest pandemics could disappear into the shadow of war. Subscribe to Fault Lines of History for more documentaries about the turning points that changed civilization.